Hello, how are you? I hope everything is going wonderfully, but if you clicked on this video, it's because, deep down, there is a doubt, perhaps a silent discomfort that you don't dare mention to your best friend, or at the bar, and often not even to your doctor. You know that sacred moment, that quick relief in the bathroom, that habit you've carried since adolescence? What if I told you that this very act, which seems so harmless and natural, could be silently acting as a villain for your health after age 60? Imagine for a second that you are driving a car. When you were 20, your body was a 4x4 off-roader. It could withstand bumps, sudden acceleration, and rough terrain. But now, you are at the wheel of a classic, a valuable, powerful machine that demands precision engineering. If you drive this classic the way you drove the Jeep at 20, the engine is going to seize up. And it is exactly about this engine seizing up that we need to talk today. I am a medical sexologist, a specialist in longevity and male intimate health, and I have dedicated the last 20 years of my career to understanding what happens in the mature man's body, helping thousands of patients regain not just their erection, but their dignity and joy of living. And what I am going to tell you now isn't moralism, it isn't religion. It is pure medical science applied to your reality. Recently, I received a patient in my office whom we'll call Anthony. Mr. Anthony, 68 years old, a cultured and active man, arrived with a classic complaint. His blood pressure medication wasn't working well, his prostate was bothering him, and worst of all, he felt that the sensitivity down there was disappearing. He told me, "Doctor, it feels like it's numb. I have to use a lot of force to feel anything." One thing led to another, and in a safe, confidential environment, we discovered the root of the problem. Anthony maintained a daily masturbation ritual, always the same, fast, hidden in the bathroom, using a technique he had used since he was 15. He didn't know it, but he was committing not one, but 7 crucial mistakes that were literally sabotaging his circulation, overloading his heart, and killing the nerve endings of his penis. And I guarantee you, the chance that you are committing at least 3 of these mistakes right now is extremely high. That is why I ask you to stay with me until the end, because mistake number 5 and number 7 are the most devastating for your mind and your relationship, and I am going to teach you how to reverse this. First, we need to align our knowledge. After 60, physiology changes. Blood flow to the pelvic region naturally decreases due to arterial stiffness. The skin of the penis becomes thinner. The prostate is often enlarged. If you ignore this new biology and keep acting on autopilot, you create micro-traumas. Let's get straight to the point. No beating around the bush. The first fatal mistake is what we call in sexual medicine death grip syndrome, or excessive pressure. Do you know what Mr. Anthony was doing? As his sensitivity was naturally decreasing due to age and hormonal drop, he compensated by squeezing harder. He thought he needed more force to feel the same pleasure. Except the penis is not a muscle you train with weights. It is a vascular organ full of sponges and delicate nerves. When you apply excessive pressure with a dry hand, you compress the blood vessels to such an extreme level that you prevent proper oxygenation during the erection. Worse, you teach your brain and peripheral nerves that only that absurd pressure is capable of generating pleasure. The result? When you go to bed with a woman, the vagina, which is soft, warm, and moist, will never be able to replicate the pressure of your hand. And then, you lose the erection. Not because you are impotent, but because you have desensitized your own instrument. It is like trying to hear a whisper after spending years listening to music at maximum volume with headphones. You have become deaf to subtle touch. This leads us directly to the second mistake, which seems silly but is dangerous: the location and position. Most men do it sitting on the toilet. What's the problem, doctor? It's practical. The problem is physics and anatomy. When you sit on the toilet with your legs in that position, you are compressing the pelvic floor and hindering venous return. Furthermore, most men, in a rush, perform the so-called Valsalva maneuver, holding their breath and straining, as if they were having a bowel movement to try to reach orgasm faster. For a 20-year-old man, fine. For a 60-year-old man, this spikes intracranial blood pressure and overloads the heart in an absurd way. I have seen cases of arrhythmias triggered in that moment. The bathroom is not a place of pleasure. It is a place of excretion. Your brain associates that environment with getting rid of something fast. You are training your body to treat sexual pleasure as biological waste, not as an experience of vitality. And speaking of speed, here is the third mistake: rushing the process. The famous quickie. Mr. Anthony took 3 minutes. It's to relieve stress, he said. Wrong. At 60, your cardiovascular system needs a warm-up. Nitric oxide, that magic molecule that dilates vessels, takes longer to be released. If you force an ejaculation in 3 minutes, you are demanding your heart run a 100-meter sprint without warming up. This generates a discharge of adrenaline and cortisol, the stress hormones, instead of oxytocin and endorphin, the relaxation hormones. You end the act not relaxed, but exhausted. Masturbation in maturity should be a gentle marathon, a stroll, not a race. It needs to last 15 to 20 minutes. It needs to involve breathing. If you don't breathe, oxygen doesn't arrive, the erection isn't sustained, and the pleasure is mediocre. Now, pay close attention because the fourth mistake is where infection and pain begin. The lack of proper lubrication. Remember I said the skin thins? The genital mucosa loses natural hydration with age. Doing it dry, or worse, using saliva, soap, which is extremely alkaline and irritating, or body lotion causes microfissures invisible to the naked eye. Those fissures become entry points for bacteria and fungi, causing balanitis and inflammation that leave the glands sensitive and sore. But besides the pain, dry friction destroys superficial tactile sensitivity. You are literally sanding down the sensitivity of your penis. Using a medical-quality water-based or silicone lubricant is not an unnecessary luxury. It is PPE, personal protective equipment for your penis. It is mandatory. We arrive at the fifth mistake, and this is the one that destroys the mind. The visual addiction, high-speed pornography. The mature man's brain, often bored or frustrated with his own performance, turns to explicit videos. The problem isn't moral, it is neurochemical. These videos generate artificial and gigantic dopamine spikes. It is a visual drug. You accustom your brain to needing to see extreme scenes, unreal bodies, absurd situations to manage to get an erection. And real life? Your wife, your real partner, with a real body, in real time, becomes boring to your addicted brain. This causes what we call pornography-induced psychogenic erectile dysfunction. The hardware, your penis, works, but the software, your brain, is corrupted by unreal stimuli. If you need to watch something to function, you are not aroused. You are high on dopamine, and that kills intimacy. This connects to the sixth mistake, which has grown a lot. The use of ultra-powerful toys or bizarre techniques to try to feel something. Some men, in an attempt to rescue the lost erection, often due to the previous mistakes, buy vacuum pumps or powerful electric masturbators and use them without guidance. The excessive use of suction or intense vibration creates the same effect as the death grip. You raise the bar of the necessary stimulus so high that no human touch will ever be enough. Use technology to your favor, yes, but with gentleness, as a supplement, not as a crutch. And finally, the seventh mistake, the saddest of all, the substitution of intimacy with the solitary habit. This was Mr. Anthony's case. He masturbated in the morning in the bathroom, spent all his sexual battery, all his available testosterone for that day. At night, when his wife sought him out, he was out of energy, tired, or it didn't work. He was stealing energy from the marriage to waste it down the bathroom drain. Masturbation should not be a substitute for life as a couple, but rather maintenance for your health. If you are choosing your hand because it is easier, faster, and without risk of failure, You are condemning yourself to emotional loneliness. Sex with a partner releases oxytocin, the bonding hormone, which protects the heart and fights depression. Mechanical and fast masturbation does not do that. Do not trade gold for costume jewelry. Doctor, so am I doomed? Have I ruined everything? Absolutely not. The beauty of the human body and the brain is neuroplasticity. You can reset this system. It is what we call sensory re-education. The treatment starts with what I call a detox. Stop with the excessive pressure. Eliminate pornography for a while, at least 30 days to clean the dopamine receptors. Use abundant lubrication, and mainly, reframe touch. Learn to touch the whole body, not just the penis. Learn to feel pleasure with light touches. At first, it might seem like it's not working, because your body is waiting for the hammer. But with patience, sensitivity returns, and it returns more refined. I saw Mr. Anthony recover his marriage. I saw him return to the office months later saying that the relationship with his wife had been reborn, that he felt more virile, not because he had rock-hard erections all the time, but because he had control, he had sensitivity, and he had connection. Sexual health and maturity is not about Olympic performance. It is about pleasure, connection, and vitality. You deserve to feel real pleasure. You deserve a healthy prostate and a strong heart. Do not let the habits of a 15-year-old boy govern the health of a wise 60-year-old man. And look, if this made sense to you, if you felt I was speaking directly to your story, know that this is just the tip of the iceberg. There is a universe of dietary, hormonal, and behavioral strategies to armor plate your potency. And that is exactly the mission of our channel, Wise Sexuality. We are not here to play games. We are here to transform the second half of your life into the best half. So, I want to extend a serious invitation. Subscribe now to the Wise Sexuality channel. Do not leave it for later. Activate the notifications, because in the next content, I am going to reveal the foods that work like a natural Viagra for the endothelium, cleaning your arteries, and bringing back the force of blood flow. You don't want to miss that, do you? Your health is your greatest asset. Take care of it with wisdom. A big hug from your doctor and friend, and I will see you in the next video here on Wise Sexuality. Until then,